She was among the first few cases in Crosse County and is now sharing her story of battling COVID-19. Now that Katie Drury has recovered, she's hoping others will learn from her experience and help to stop the spread. Before there were any confirmed cases in the county, Katie Drury was studying up on the new disease. As a healthcare worker, she wanted to learn more to educate herself and others, especially since there is no vaccine or cure.
I felt it was really important to understand it the best that I could.
Still, she didn't immediately know that she was sick with it.
I was able to easily equate my symptoms to just common things.
On March 17th, she had a very slight cough. By March 20th, she had some body aches. Drury thought the added stress on top of some pre-existing conditions was behind it.
I just chalked it up to that.
During this time, she was alerted that she may have been exposed to a case in the county. Then she got a raging sinus infection, or so she thought. Drury took medication, but nothing worked.
Knowing that I was having some symptoms that just were a little unusual, I thought I'd reach out to my doctor.
She was told to go to a drive-up testing site.
It was less than 24 hours later that I received the call that I was positive for COVID-19.
She had to stay away from her family with her own room and bathroom for 10 days. It was then that the symptoms ramped up.
I started to have this burning pain when I would take a big breath.
Shortness of breath, cough, fatigue. She had migraines in the past, but this time she could only take Tylenol, which didn't scratch the surface. She laid there in pain.
As you struggle to breathe, you panic.
She was alone, without her husband or daughters.
That was, sorry. That was hard.
Drury did eventually go to the ER because she was struggling to breathe. Her husband was not allowed to come with.
The hall was empty. There was nobody in the halls.
When staff would come to check in on her, she could hear them outside the door.
Could hear them getting ready, putting on all their gear. You know, there's lots of layers to what they have to wear.
Katie is one of the lucky ones. She was able to head home from the hospital.
I actually took a picture of my nurse and I on the way out.
Now having recovered, she's sharing her motto with others. Now's the time for we, not me, meaning get educated about the symptoms, how it spreads, and the potential risks.
It's time that we work together to protect one another. You know, there's no other way. There's no other way.
She still has to be isolated in her house, but can be around her family. Next week, Drury will be able to go out in public, and she says she's really looking forward to going for little walks as she gets her energy back up.